Prostate cancer was on my radar, not because I was concerned about having prostate cancer. It was because I knew that Black men die 2-to-1 to their counterparts. And so I knew that this was an issue, but I never expected it to be an issue of mine. So I'm 48, healthy, exercising all the time, eating right. I've had my annual screening, so I had no concerns that I had problems, but I knew that at this age, I probably should be getting new tests that I never had before. And I think it was around the time that we were feeling the pain from Chadwick Boseman's death from colon cancer. So I go to the doctor and I let him know, look, I need to get the colonoscopy added to my prescription as well as the prostate screening. And he felt that I was too young to have it, that men should probably have prostate screenings at age 50 to 55. So he didn't write the prescription for that. Something in me told me that you have to keep pushing to get what you need for your own health. Because what I've learned through being a state representative and being on hospital boards and being on community health boards is the science is different for Black men versus white men. So I knew that the science that my primary was talking about was not inclusive of Black health.
The fact that African Americans are 50% more likely to contract prostate cancer and are more than twice as likely to die from it is a huge problem in this community.
I went to a Black doctor that did my colonoscopy and I made the request, and immediately he just said, okay. And the prostate screening was done.
The PSA blood test is a very easy test, non-similar to a blood draw that you would have at your primary care physician for a blood count or a kidney function study. PSA is a protein in the prostate and the semen. It's also a marker for cancer. If the PSA level rises rapidly or it rises too high of a level, then the suspicion of prostate cancer is there.
When I got the test results, I learned that 4 is normal, but it should be lower than that. But then when they say that my test came back at 12, we knew I had a problem.
So when I met LaShawn, we talked about retesting his PSA. We also talked about a prostate health index. Those 2 tests came back elevated. And so I said, next step will be an MRI. And then based on reviewing the MRI with the radiologist, we determined that a biopsy was appropriate.
After doing the biopsy, it was confirmed and conclusive that I had stage 4 cancer that was aggressive. You know, and had I listened to the doctor that told me I was too young to have prostate screening, I probably would not have lived to be old enough, according to science, to even take a prostate exam.
We spent over an hour together talking about ways that he could treat his prostate cancer. And that's one of the beauties of our program at Northwestern Medicine is that we have the bandwidth to offer multiple treatment options for our patients. We decided together to move forward with surgery. And the good news for LaShawn was that this cancer was contained within his prostate, which in terms of his long-term prognosis for survival was really outstanding because that makes cure much more possible. He was cancer-free for some time, and LaShawn had approached me and said, you know, I want to try to take my case to the public. I want to show them what I went through, and I want to make a difference for other men. And so what he decided to do with his press conference was amazing. Very few men are willing to get out there and show that kind of vulnerability. He did, and that makes him a true champion.
So there's this quote by Dr. Martin Luther King Jr., and it goes, "Faith is taking the first step, even when you don't see the whole staircase." And that's what's guided my entire journey on beating cancer. You never know what's gonna happen in life, but you have to have faith regardless to what comes your way. I didn't see any stairs. I just saw cancer. And so we took the right steps, and I can't imagine things happening any better.